You cannot purchase any products that have hydroquinone in them in Europe.
Why it's so important to go to someone who has experience, has knowledge, who you're going to stick with.
When I look at the candidates right now, everyone's so impressive.
Some plastic surgeons feel that they can feel it a little bit too much when they're trying to do a facelift.
Patients who are confident with how they look feel good in their skin.
They shy away from sunscreen, which is not good.
In my office, I find myself reaching more so for things that help to drive collagen as opposed to actually filling the skin with, let's say, a gel.
Even though the ring tells me that I need to sleep more, I feel refreshed after 5 hours.
I've personally used polylactic acid or Sculptra in my thigh.
Where are the cool off-label areas that you're injecting bio-stimulatory filler?
I've definitely done.
I'm Dr. Anthony Rossi, and this is Give Good Face, a podcast focusing on skincare science, and how to maintain and shape a healthy lifestyle. Hi, everyone. Welcome back to Give Good Face, the podcast where we talk all about beauty, health, skin, science. And today, I am so happy to have my friend and colleague here, Dr. Lian Mack.
Hello.
Hey,
how are you? Good to see you.
Great to see you. It's not been that long.
I know.
But actually, Dr. Mack and I went to medical school together.
Yep, at Cornell.
Cornell. Yeah, we're proud alums.
Yes.
And then I followed her to residency.
Well, I actually said, if you don't take this kid, I quit,
Yeah,
right?
yeah.
You are a few years younger than me, but
She looks younger than me.
I don't know about that, but I was just so happy to be in residency with you. You were an awesome resident.
You were like my mentor, my friend, my guide throughout all of residency, which can be a struggle for a lot of people out there. Yeah.
Yeah. We roomed together at AAD, right?
We had fun times in Miami together. So at our national conference. So we've been through a lot and we're still friends. And I'm like so proud of Lian because she started GlamDerm, which is an amazing derm office both in Manhattan and Westchester.
Yeah.
Now you have 2 practices.
I do. You know, it wasn't necessarily my plan to expand, but COVID sort of forced me to open the second location. We moved and I just felt like I wanted to be more present for my family. And so I opened the second location just out of necessity. But I started GlamDerm in Manhattan in Gramercy about 11 years ago.
It stands for Gramercy Laser Aesthetic Medicine or no?
So it stands for, most people think it's glamorous, but it really stands for Gramercy Laser and Medical Dermatology. And so I opened maybe like 3 years out of residency.
Wow.
Just realized very early on that I had an entrepreneurial spirit and I kind of wanted to run the show. That's just my personality.
You're a boss, yeah.
I'm a boss. And so it's been I've had a great run. I have a lot of great colleagues that I work with. And so I'm really happy with where I'm at this point in my career.
So for a lot of younger dermatologists who are still in residency or just getting out, is it doable? Like, is starting your own practice a thing? Is it still a thing? Can we do it?
So I definitely think that coming out of residency, you might want to consider working in another practice. I think that for me, working in someone else's practice actually prepared me and taught me how to run my business. I don't know that I would have had the same expertise or confidence coming out of residency. But I will say that it is doable. I think residents and people that are coming out of residency need to know this given the current climate of things. So there are a lot of private equity companies that are purchasing practices, starting practices, and they have a lot of money. And running a practice requires a lot of money. There's a lot of overhead. But I do think it's doable, but I would recommend getting a little bit of experience first.
Yeah. And I think it's amazing because owning your own practice, you're the boss, but you're also the treating physician. You have other dermatologists with you, but you're really always putting the patient first. Like it's a patient first model.
Right.
It is of course a business, right? But you're always thinking about the patient, which I think is what your patients love about you and about the practice because, you do send some people over for surgery and like they're always raving about GlamDerm. Yeah.
So you are my go-to Mohs referral. I would like to say that we do a great job of diagnosing, skin cancers, but Dr. Rossi, or Aunt, as I like to refer to him, does a great job of treating them.
Thank you.
And my patients actually speak really highly of you, and I'm not bowing down, but they do. They love you. I'm like, he's really cool. He has great hair. He's fun. Some of my patients have been repeat patients with you.
Sure.
So you're definitely my go-to Mohs guy.
Because we are still seeing a lot of skin cancer, even though we keep preaching sunscreen.
Right.
Like we're still seeing it, which,
a ton. And I think that with COVID, there was actually a lot of delay in diagnosis, right? So post-COVID, I felt like I was doing so many more biopsies and diagnosing so many more skin cancers.
Yeah, it's true. And, definitely wear your sunscreen, but also get your skin checks with your dermatologist, because we're seeing them now in your patients as well, like basal cells or even melanoma, which we always want to detect early.
Right. And so that brings us to yesterday was National Dermatologist Day.
That's right. Yeah.
And
Happy Dermatologist Day.
Happy National Dermatologist Day.
You were on the stock exchange.
I was with a brand called Alta MD, which, as if you're a dermatologist, we all love.
Yeah.
But what I loved about the message in the meeting yesterday was that, there's Donut Day, there's Margarita Day, there's National Pizza Pie Day, but we actually save lives. So I definitely think that having our own day gives us recognition that we're diagnosing skin cancers and treating them. And I think that it brings attention to the fact that our profession is more than just aesthetics.
For sure. I mean, so many people just think about the aesthetic component of dermatology, but they forget like skin health,
right?
All these skin diseases that we treat on the regular. They're really important because there is that skin-brain connection, and like how you feel from your skin is really important. We know there's this whole emotional connection.
Oh, 100%. Patients who are confident with how they look feel good in their skin, right? So I 100% agree with that. So I'm glad that we have our own day.
Yeah.
And it makes me feel proud to be part of a profession that is valued.
Yeah, it is. It feels great because I feel like people like coming to see us for the most part. They're always a little bit nervous when it's surgery day, but they're happy. They're very happy. So it's been a great career choice.
Yes, I'm very thankful that I matched in dermatology because it is the hardest specialty to match in.
Yeah,
and I think it continues to be.
It's still up there for sure. And like the medical students out there, like if you want it, go for it. Yeah.
Right. I mean, I don't know. When I look at the candidates right now, everyone's so impressive. I'm
off the charts.
Off the charts, yeah. So it's hard to compete with that.
But find a friend who's going to help you. Like I found Lee, and like she guided me through the whole process, which was great. Yeah. So definitely buddy up.
Yes.
And then in your practice now, what are you most passionate about? What are you seeing? What do you like to do?
So I think, my demographic, my patient demographic, the age range that we see skews on the younger side. What we're seeing.
Like millennial, Gen Z, or?
Yeah.
Okay.
A lot of patients want to continue to look their best without looking overdone. And so in my office, I find myself reaching more so for things that help to drive collagen as opposed to actually filling the skin with, let's say, a gel. So one of the things that I love and we've been using since residency, it's called Sculptra.
Yeah.
And it's a filler that basically is a biostimulator. And what that means is it's that this molecule helps to drive your collagen production by stimulating cells in the skin called fibroblasts. Yeah. And so it does take a little bit of time to see the result, but patients feel like they look refreshed, they look better, but they still look like themselves.
They still have the same structure. Yeah.
Exactly, but just more youthful. I think it also helps with the tone of the skin. So patients who have acne scarring, for example, I think it improves that as well.
Nice.
It improves laxity. So I know that I've definitely used it off-label to parts of my body.
We're always testing things out.
Yeah, it's like our candy store. We just pick and choose from what we like. So I think that that's been the trend. I think people want to do procedures, but they don't necessarily want a look that's overdone. We've been also doing a lot of platelet-rich plasma or PRP. There's also something called PRFM that we've been using. I inject it to the tear troughs, the smile lines all the time. So.
And for those out there, PRP is, we're harvesting your blood, spinning it down, collecting the platelets, and then re-injecting them back. Sometimes we activate it to make the fibrin.
Right.
and it comes out like a gel, and then you can re-inject that. So it's all in sort of the space of regenerative medicine.
Exactly.
Yeah.
I definitely think that's the way that things are trending right now, at least in my practice.
Yeah, for sure. There has been a little bit of a filler bashing online.
100%.
Yeah. So
I've seen that.
It's really interesting because I think when Kylie sort of had that festoon, and then she dissolved it, the world went sort of dissolving crazy. And like everyone said they were dissolving their filler, though you and I both know that they might have been dissolving some, but then replacing it in other areas.
Yeah.
What's your take on that? Are people coming in asking?
Oh, I see people who are being seen by other doctors that might not feel comfortable asking them to dissolve it in my practice, asking me to dissolve it.
Wow.
And I think that that's, again, sort of supporting what I was saying before, that people don't want to look overdone. They don't want to look puffy. And I think the days of doing like 7 syringes to someone's face is actually over right now.
Especially for like the younger population, some more mature faces may need that volume, but I think it's underscores like why it's so important to go to someone who has experience, has knowledge, who you're going to stick with, and then, have like continuity and longevity with, because they know your face, they know what goals you want. And so I want, people ask me a lot, and I always tell people it's not necessarily always the filler. It's sometimes the person injecting the filler.
100%.
Yeah, totally.
It's so much of it is determined by who is injecting you.
Yeah.
If they understand your anatomy, if they understand the dynamics or properties of the actual filler. Not all injectors are created equal. That's for sure.
Exactly. And just because you have filler doesn't mean it's going to migrate. It doesn't necessarily mean it's going to like festoon or cause you to look differently. But if it's placed well, if it's placed in the right area, and like you said, in smaller amounts, you can gradually build over time.
Yeah. What are your thoughts on whether or not filler actually disappears over time?
Or goes away? Yeah, it's really interesting because people will say like, we think it lasts for a really long time. Well, we know it lasts. And I always say those studies that they conducted in the trials on the product, they have to stop at some point. So whether it's a year or 2 years, they get that duration on the label that says this lasts up to 2 years or this lasts up to 1 year. But in reality, you and I know that the gel or even the biostimulatory fillers like the calcium hydroxylapatite, the PLLA, those they all integrate into the tissue. And, when we cut into the skin, for either Mohs surgery or if for aesthetic, surgeries, you can actually see filler still in these places. And people are like, I've had that years ago.
Right.
But it can last, especially in these non-mobile areas. So not like around the mouth, but in the tear trough or the cheek.
Yeah.
And so that's why I think starting slow and like building gradually is really helpful. Because like if you inject too much too quickly, it's going to last for a while. And that may not be what the look you were going for.
Right. It's a conversation with my patients, definitely. When they come in and they say, I'm due for filler. I had it done 12 months ago.
Yeah.
I'm like, well, actually, you still look like you have product, right? For
you're a good doctor.
I'm honest in that way. And my job is sometimes to say no, which I'm very comfortable saying. But I have seen a lot of the fillers last more than 15 months.
Yeah, for sure.
More than 2 years.
Yeah.
And so I think it's our duty as dermatologists to really tell people, it's not the ideal time for you to get more filler.
Exactly. Saying no is super powerful. I think it builds trust. It gives your expertise and like
100%.
It's really important. So, sometimes people may feel pressure because their patient's coming in and they're like, I want this, but it's really important to say no. You're helping in the long run. And you're right. It's lasting longer than just what it says on the label. Because at some point they had to stop following it.
Right. And everyone metabolizes or breaks it down differently.
Yeah.
So that's what's going on in my office.
Yeah.
A lot of honesty, sometimes no.
Yeah. Sometimes
a lot of biostimulatory treatments.
I want to know where are the cool off-label areas that you're injecting biostimulatory filler?
Oh, so I've definitely done some butt lifts with polylactic acid, which is Sculptra. I have injected Sculptra in the neck area.
Nice.
However, I will not inject hyperdilute calcium hydroxyapatite, which is Radiesse, because there's concerns on X-ray or any imaging. This molecule looks white, and so sometimes it can confused radiologists, like, is this a mass? Is this a nodule? So I won't use that there. I've personally used polyalactic acid or Sculptra in my thighs.
Yeah.
As you get older and your estrogen drops, things start to get very loose. So I've tried those areas, like above the knee where it gets a little crinkly.
Yeah,
too,
the crepey knees.
Yeah.
Every morning in the gym, I look at my knees and I'm like, at some point, I'm going to have to inject something.
It's one of those areas that's just like, as much as you work out, it's just once you start losing that elastin and collagen, it gets.
And it makes sense because like the knee is a mobile area. So you're stretching that skin constantly every second.
I don't love my knees either.
Yeah. Yeah. Now I'm just super conscious about my knees. No, but it's cool because we have all this technology, and like there's even some fillers not in the US but overseas that are combining these different types of fillers like HA plus, which I think are really cool because you're adding this biostimulatory component to the HA, which gets the hyaluronic acid, which gives a more immediate lift.
Right.
You know?
So I always say that things like Sculptra are for the patient, right? Because it does take time to see the result. But I think once you get to that endpoint, patients are really happy.
Very happy. Yeah, we used to inject so much in residency. And the butt lift is interesting because not everyone wants a fat transfer to the butt, or they just don't have enough fat to actually harvest and then put in.
Right. I do think that it also in that area helps with the appearance. If you have dimpling or cellulite in that area, it helps with that too.
Yeah, cellulite's really challenging. So,
I mean, we've had so many different treatment options for cellulite. I've had cellulite since I was in high school, and most women do have cellulite.
Yeah.
I just don't think do you know of anything that's really good on the market right now?
Yeah, I mean, the manual subcision, like going in and breaking up the dimple and then replacing it with some sort of volume, whether it's Sculptra or like fat transfers, I think it does help. It helps the improvement of it. But yeah, I do tell people that most people have some sort of cellulite, change in their skin. And it's actually a pretty, normal occurrence, so not to even working out doesn't always help it, know? So, we always want to give good body positivity but
it's okay.
We're here to help. Yeah.
Right. Something that a lot of women, mostly women, struggle with.
Yeah. No, I think it's really cool that, so Sculptra is made out of like material that we use for suturing. So it actually causes the body to create this reaction and then sort of build up collagen around it. I know some plastic surgeons, feel that they can feel it a little bit too much when they're trying to do a facelift,
I've heard that.
Yeah. And so it's interesting. We'll have plastic surgeons on in the future. So I'm going to ask them that question.
Okay. Get back to me.
Yeah, I'll let you know. But how do you feel about the surgical versus non-surgical? Because we have so many non-surgical things now, like not only the fillers, but also the tissue tightening devices. Are we really saving people surgery, or do you think they're just delaying it, or do you think it's really a combination of both?
I think that with all of the non-surgical interventions that we currently have, we're somewhat delaying it or pushing it back. But if you're, 70 years old, 75 years old, even though you're continuing to produce collagen, the natural aging process is still happening, right? And so you might be delaying it, but I think that it's ultimately inevitable. If you have so much laxity in your face, there's only so much that, a microneedling or radio frequency device is going to do. I do think that the non-invasive treatments are really helpful at sort of keeping people looking more youthful, but it's not, if you're 75 years old, it's not in lieu of a facelift.
Totally. And I mean, growing up in dermatology, we've seen so many older dermatologists look really good, actually. And they've just been like doing these little micro treatments all along the way.
And using tons of sunscreen.
And sunscreen.
And retinoids.
And retinoids. Yeah.
And vitamin C.
And all of the above. So it really is like a use case to show that like if you're consistent from an early age, not necessarily doing all of it at once, but little by little, you can really like help the aging process along.
Yes, definitely. Yeah. I think for the younger generation, the tweens out there, I mean, with the Sephora Ulta craze, I think the main thing that I recommend to parents is sunscreen. That's the number one thing.
Yeah, exactly.
And then everything else comes later.
Yeah. And the mineral sunscreens like the titanium and zinc dioxide are great for kids. Like they're non-irritating. They don't really, bother their skin if they're sweating or not. So I think it's a great option. So.
And I do think that there are a lot of cosmetically elegant formulations with zinc and titanium dioxide. My kids are kids of color, so if you try to rub zinc on their face, they look like they're kind of miming a little bit.
Yeah.
But I think that the formulations have improved. So.
And are your kids like into the skincare craze or they're not?
So the benefit of being the daughter of a dermatologist is that I get a lot of stuff to try and play with. So my 11-year-old, she'll go into Sephora, but she's like, Mom, I actually have Augustinea spatter at home.
Oh,
so.
wow.
I'm like, you're getting these. Like, she's like, I'm good. Maybe I'll get a Summer Friday lip gloss.
Love her.
She will go into Sephora, but she's kind of just wandering around and then she'll defer to me. She's like, you're the expert. What should I do here?
Oh,
and
nice.
I appreciate that.
That's great.
So I have her, listening to me for now.
That's amazing.
Yeah.
We could talk a whole podcast about how to get your kids to listen to you. Yeah.
I don't know that I'm the poster child for that, but right now I'm doing something right.
That's good. Because she also plays sports. So you're constantly putting sunscreen on her.
Oh, yeah. But she's good about it.
Is she?
She has her spray. We do a spray for the body, a cream for the face. She knows to reapply every 80 minutes. She wears a visor. She has polarized glasses. She has the whole 9 yards.
That's awesome. Because I see a lot of people who used to play a ton of sports when they were kids and now they're unfortunately just dealing with all the skin cancers that come out later on. And, swimmers, especially, they're in the water, that water is reflecting UV, tennis players, golf players, we just got to be smart with the kids early on and get them into the habit. Yeah.
And I do think that there's a lot of awareness now. And I mean, my kids aren't on social media, but even on social, I think that there's just so much more awareness than when we were growing up,
for sure.
right? I don't think I
was getting sunburns all the time.
Right.
Sorry, Mom and Dad.
You'll just get a little glow. You look really healthy. I remember getting burnt on my nose multiple times when we would vacation. Yeah. But I think there's more awareness, which is great.
Which brings up a good point, because you said skin of color, melanin-rich skin. Sometimes they shy away from sunscreen, which is not good because you just said you were getting burnt on your skin, right? So it's really important to use sunscreen in all different skin types, right? Not only for skin cancer, but also for hyperpigmentation.
100%.
Yeah. So
for skin of color patients, I do prefer tinted sunscreens to prevent hyperpigmentation. The iron oxide provides extra protection, not only to UV radiation, but blue light. So we're always in front of a screen, a phone, iPad. And also, I do think it helps a little bit with the indoor visible light.
Yeah.
And there are, again, so many options now, right? There are a lot of different shades.
Yeah.
There are some brands that market a universal tint, and then there's some brands that actually make a deeper tint for darker patients.
And I do say, if you're going to make a tinted formula, you really need to go through the range of all different tints because it isn't really one shade fits all. And that's the hardest. Yeah. But so you bring up a good point, the iron oxide. That's the ingredient that is used in tinted makeups or tinted sunscreens. And that really does help protect against the visible light. So the red, blue, everything that makes up regular light that we see, but that also contributes to hyperpigmentation and melasma.
Exactly.
Which is so hard to treat.
Oh, tell me about it. I still have melasma from my last child.
Yeah.
And it's one of those things that I'm constantly treating. There's no cure for it, unfortunately. I always manage patients' expectations with it. I'm like, listen, we can definitely make it better, but it tends to come back. And it's just really reactive to heat, right?
Yeah.
And even if you're protecting, if you're going in a sauna and you like to be outside, that heat sort of stimulates your cells, the melanocytes, to drive more pigment. So, but yeah, you can just do what you can do and try your best.
And I also think melasma is so hard because unlike something like rosacea where you get the stimulus like the heat or the spicy food or the caffeine and you see the red flushing right away. Like melasma doesn't happen that quickly, right? It's like from this, it's this gradual build of pigment that people can't really associate with one particular event because it happens much later afterwards, unless it's pregnancy. But
or I mean, just even if you grew up in a sunny environment,
totally.
or if you've been taking birth control pills, we know that it can be hormonally driven too.
Yeah.
But it's one of the more frustrating conditions to treat for sure.
It really is tough. Yeah. That's also another place where patients really need patience, right? And they need to stick with someone who knows what they're doing, because gradually you can reduce it. It's just you may not get rid of it completely.
Yeah.
Any go-to in particulars that you love from melasma? I know this is a tough question.
I do treat a lot of melasma in clinic, but for me personally, I'll sort of alternate between a very low level of energy with a laser device. And I'll alternate that because if you're using a device that has a lot of heat, that can actually worsen the melasma. So I'll alternate on myself a device like that with chemical peels. And I'm also, to be honest, if you want something at home, I'm obsessed with Suspera.
Oh, nice.
I love Suspera.
What is it? Tell us. Yeah.
So Suspera is a topical that you can use at home that is free of hydroquinone.
Okay.
Hydroquinone gets a bad rap.
Yeah.
You cannot, to my knowledge, it's banned in Europe.
Yeah.
Right? You cannot purchase any products that have hydroquinone in them in Europe. It has a molecule in it called cysteamine that basically helps reduce pigment production.
Nice.
And it's nice because you can do it at home. It's short contact therapy, meaning that you apply it to dirty skin, meaning that you don't wash your face before you apply it. So I usually do it in the morning while I'm getting my kids ready. You leave it on for 15 minutes. And I'm happy that the duration is so short because it really stinks. It smells really bad.
Oh, and
it has a really distinctive, horrible smell. And then you do your moisturizer, antioxidant, sunscreen. That's kind of like my maintenance.
So you wash it off after 15 minutes?
Right.
Yeah. Okay.
The study showed that if you kept it on for a longer duration, it was irritating.
Yeah.
But yeah, so that's kind of my go-to on a day-to-day basis. The protocol is to apply the product for 15 minutes daily for 4 months. And then the maintenance, because melasma is a chronic condition, is twice a week for 15 minutes. So.
That's a good pro tip right there. Yeah.
So I recommend that a lot to my melasma patients to help them maintain. And then during the summer months, I sometimes prescribe a pill called tranexamic acid to help them maintain during the summer months.
We've heard about TXA a lot. It used to be for clotting, for people who had heavy bleeding, but they noticed that their pigment got better, their melasma got better. So
what a great side effect.
Yeah, what a great side. It's like when you find out something grows hair, you're like, wow, let's do that. That's how minoxidil was found, right? Minoxidil was used for blood pressure, but then in the trials, they said it grew hair and, there it lies. So TXA is great, for some people, right? It doesn't work for everyone, but it does help. Yeah.
I don't like my patients to stay on it forever. I think that
because there's a risk of blood clots. Yeah.
Right. And if I have a female patient who's on oral contraception, I won't prescribe it, but I do like it sort of as maintenance for the warmer months.
Yeah. Very cool. So when the younger patient comes into your office, because you probably get this, right? And they just want to be proactive and do the most. And how do you
get
the glow up? How do you counsel them? Because I think it's hard now. And, I was with someone else talking about, body dysmorphia and, sort of the look maxing. You have girls, right? But a lot of young boys are now trying to looks max. Have you heard of this?
No.
Yeah.
Tell me more.
It's a trend where they're just trying to look their best. Some people also do smell maxing where they're using different colognes or mixing fragrances to smell their best. And it's really happening in this younger teen boy generation.
Oh, okay.
And sort of to just look and feel their best, but also look their best on social media. So we're really becoming a youth obsessed, look obsessed. But
I mean, it's
always been there, I guess.
It's always been there, but it's now exemplified because of social media, right? And so, I mean, we could go down this rabbit hole of how social media is bad for you, but it's also beneficial for a lot of things skin awareness, skin health, all of that. But I think that this trend to have scent masking or this is all because of social media and what people see with filters and how it alters your natural state. I'm not really too familiar with what you were mentioning, but I think that just speaks to a larger problem.
Yeah, I had to talk to my nephew about it because he's in high school and he's
Nico?
like, yeah, it's all, yeah. He's all around. So he educated me on it as well, which is important. But, you know.
He also has great hair.
Yeah. He has great hair. Oh, yeah. That's the other thing too. Like very much, my parents are hairdressers. So like a lot of people coming in, like wanting the new do, like getting that flow, you know? So it's like, it's an interesting time because you're right. I think social media is just driving so much of this. And then to constantly see a near perfect image of someone, like as you're scrolling, everything is like either filtered or AI.
But even though people know that it's filtered or AI, they're just like, wow, this photo is so amazing.
Yeah.
But it's not real.
And your frontal lobe just keeps getting hit with these near perfect images of people. And like at some point, we're going to start to create an idea that that's what's normal, which it's not, you know.
Have you seen?
There are no filters on these cameras, but
I know.
Yeah.
Maybe I need one for Melasma. Have you seen the movie The Substance?
Oh, I did. Yeah. What do you think? It was so apropos to dermatology. Yeah.
To be honest, I was not able to finish watching it.
Oh, really?
I couldn't. I was just very disturbed by it.
Yeah. I'm so happy you brought this up.
Oh, really?
Yeah. I've been wanting to talk.
Should I drink the substance?
Yeah. No, I've been wanting to talk to someone about this, you know?
Really?
Yeah.
So tell me, what were your thoughts? I want to say I made it midway through and then I was like, I just can't watch.
Do you know what happened at the end? Or?
No, you can definitely, I mean, maybe not.
I don't want to spoil it
for the viewers.
I mean, there's so many, like I think Demi Moore was a great cast for that.
She didn't win.
She didn't win, but I thought they did this is someone who's been in the public eye forever, right?
And she's clearly had cosmetic work.
She's clearly had cosmetic work, and we sort of know she's had multiple procedures done, right?
Right. And reversal of some things.
And reversal of some things that's in the public domain, right? And so we've heard through that. But she's an amazing actress, and like she's been in so many amazing movies, like A Few Good Men, right?
G.I. Jane.
G.I. Jane. And yet all anyone can talk about is like how good she looks now. And like no one really talks about like her art. Yeah, her art, her craft, like how great of an actress she was. And so it centers so much about her beauty and aesthetic, which I guess because she's an actress, she's in the public eye, like people are going to comment. But the fact that she's in this movie about a substance that like sort of brings out your best looking, you know, best feeling persona is I think so fitting. I think it was for her. Yeah. And I think it was such a good cast on like the part of the director. I believe it was a French director, and she was like making this film to comment about how obsessed we are with like women's looks. And after a certain age, if they don't look a certain way, they sort of get disregarded.
Right.
Which is a totally sad.
But it's true.
But it's true. Right. Yeah. Because we are in this culture that really praises youth and the way you look, regardless of like how many accomplishments you've had.
Right.
And so as a dermatologist, I was like, wow.
Yeah.
I was like, this movie's insane. Yeah. I liked it.
I wanted to like it enough to continue watching it, but I just had to cut it. I was just, I'm done.
It was a lot, but I thought it was great, you know. And there was a lot of great movies, but I'm so happy you brought that up because
I mean, I've just been wanting to say, to be honest, I drank the substance.
Yeah. Botox. Yeah.
That too.
Yeah, exactly. And that's the other thing. We are in this era where we do sort of have all these substances that we can take, you know, even now. We talk about GLP-1s, you know, so often. And then like in the gym, you know, so many people are talking about peptides. Mm-hmm. They have no idea what a peptide is,
right? But
they're willing to take it because they think it's going to give them this advantage or make their body change in a certain way. But I try to tell, you know, anyone who listens to me at the gym that like when you inject a peptide, it's mimicking something in your body. Mm-hmm. So it's naturally going to like also shut that down in your body. And so like you're really like titrating or playing with like your hormones and things that you may need later on. So you don't want to shut them off completely.
Right.
And so if you're really like thinking about doing these things, you have to go to a board certified doctor.
Right.
Like, you know.
I mean, I think there's just so much that we still don't know that it's a little. People market these things like exosomes, peptides as being safe, but we really.
There's so much research that needs to, and you know, people are obsessed with Brian Johnson and like what he's doing to like live forever.
Right.
But he's really just throwing the kitchen sink at it. right?
Right.
Like, I feel like he's using every device that we have currently on the market, and maybe some that aren't on the market.
How old is he?
It's a good question.
Oh.
But like he uses, I think he's in his like 50s, but I need to fact check that.
Okay.
But he's doing everything. Like he's doing the biostimulatory fillers. Like I watched part of that documentary. He's doing like so many of the devices that we have in our office. He's taking all these supplements. But like by throwing everything at it, like what's working?
Yeah, you don't know.
Exactly.
Yeah.
And like, are you really living too at the same point?
Because you're just living to take supplements.
Yes, exactly.
And, be on your injection schedule.
Yeah. It is a lot. Sometimes it feels overwhelming. Yeah.
It does. I mean, even people ask me all the time, don't you just treat yourself in your office? And I'm very transparent in that I rarely want to treat myself at the end of the day when I've been treating, tons of patients. I'm usually just wanting to leave and go see my kids. And so my treatments usually happen, very infrequently.
Yeah, exactly. I feel the same. I'm like, I know I should do something, but I'm like, I just want to sleep.
Right. Right. So...
Which is very important for aging, sleep.
Oh, yeah. We both have our little Aura rings on, which I recently got. I'm obsessed with.
I love it.
I think it's like a gift and a curse, though, because sometimes, so your Aura ring tracks your sleep.
Yeah.
It also gives you a numerical value for your readiness for the day. And sometimes when I see that number, if it's low, I like mentally am just telling myself I'm going to have a horrible day. Does that happen to you?
I like try to not look at it right in the morning because I
do that.
Unless I also have like this uncanny ability to sleep anywhere. You probably, didn't I sleep on the floor at some point? Yeah. But I do, like, I don't sleep a lot of hours, but I do feel like I get quality sleep.
So your efficiency is good.
Yeah. But even though the ring tells me that I need to sleep more, I feel refreshed after 5 hours.
Oh, that's amazing.
But the ring keeps telling me I need more sleep.
But then your efficiency score should be high, though.
It does borderline high, so that's good. Yeah. But what I like about it is that if you do go out like the night before, or if you had alcohol, it kind of picks up on the nuance. Yeah.
Right. And it also knows when you're sick. I was coming down with a cold, and it gave me an alert saying there's something wrong with you.
Yeah, because it can track like your heart rate variability, which is really interesting.
Yeah.
So it's so amazing that we can wear these devices and then like track ourselves. But it also takes the ability for you to recognize it, look at it, and then intervene. Because like a lot of people just won't intervene,
Right. Like if I have a glass of wine, it affects my sleep.
Yeah.
And so I've decreased that because sleep is the most important thing to me because I'm so tired with work, kids, I just need, I get like 7 hours.
Oh, that's
I try
great.
to get 7
That's
hours
amazing.
a night.
Yeah, no, I think we have all the technology and the tools to like live our best life. We also just have to walk through the door and do those, which, I mean, you and I both know it's hard to change behavior.
Of course.
Yeah.
We are creatures of habit.
Yeah.
Right? Just try your best, though.
Yeah.
That's what I would say.
That's a good motto.
Try your best.
Amazing. So what are you looking forward to most? We just came back from the big academy meeting. There's a lot out there, but is there anything that you're looking forward to like in the world of dermatology?
Figuring out a way to standardize care.
Oh, yeah,
right?
That's
and
right.
We've been seeing a lot of other countries sort of, you go in, you get an assessment, they create a detailed plan for you, and everything is executed in such a seamless way. I think I'd like to see more of that here. And I think patients would appreciate that because you're able to spend meaningful time with them and really talk through a treatment plan that makes sense and that they can understand.
I really, I spent time in Korea making my skincare line, and I worked with dermatologists there, and it's very much like that. It's like you go in, and I do feel there's a lot of loyalty there as well. And so like you find a doctor that you like, they stay with them and they go on this journey, and it really does, it does work. It does help. And like they stick to the plan.
Yeah.
It's amazing to see it happen. Yeah.
Right.
And everyone's like super diligent about sunscreen and skincare and like, I love it. It's the skincare mecca.
Right.
Yeah.
You could learn a little something from them. Yeah. So that's what I think I'd like to see more of. But again, just this trend of being more natural, but still looking a little bit enhanced and looking like a better version of you. I think that's what I'm seeing, and I think we'll probably see more of.
Yeah. the no makeup look, the natural.
I love the no makeup look.
Yeah.
That's my jam.
Yeah, it's great. It's also like it's highlighting the best characteristics of like who you are. And the same with the fillers and with Botox, it can be done so artistically and so naturally that you never even know it's there.
Right.
Yeah.
And that's why I tell my patients you should really just invest in your skin's health and not invest in Sephora products.
Yeah.
It's really about improving your skin's appearance, which improves its health and makes you ultimately feel better.
And you don't necessarily need so many different products. Like I've seen people like overdo it where they're irritating their skin, they're coming in inflamed, and like really you just have to stick to a core base of products that feel good for you, that you've tried, that you think work, and that your dermatologist recommends.
Yes.
Yeah, exactly.
Ding, ding, ding.
Yeah. This is awesome. No, I'm so happy you came. Yeah. I know you're a busy person. Yeah.
I am, but I will always make time for you because you're one of my favorite
You're the
people.
best. Thank you.
Right. Yeah.
Thanks so much for listening to this episode of Give Good Face. Subscribe on Apple Podcasts, Spotify, YouTube, and wherever you listen to podcasts. And follow along on social at Dr. Anthony Rossi and at Rossi DermMD.